Welcome to the Graphic Medicine Podcast. I'm your host, MK Serwick. With Ian Williams, I co-run graphicmedicine.org, a website that explores the vast intersection of comics and health. On today's show, New Yorker staff cartoonist and doctor Ben Schwartz talks about the history of medicine, health, and doctors as reflected in the gag comics of the New Yorker magazine. Before we begin the show, I want to tell you that support for this podcast comes from the Penn State College of Medicine Department of Humanities, the nation's oldest humanities department within a medical school, pioneers of innovation in medical education since 1967. To learn more about Penn State College of Medicine Department of Humanities, go to www.med.psu.edu/humanities. Without delay, let's get to Ben's fantastic talk. And keep your eyes on your screen. There are over 200 comics to look at in this presentation.
Talk of the gag reflex. Today we're going to look at a portrayal of medicine and of doctors in one very specific pop cultural outlet, the cartoons of the New Yorker. So the way this is going to break down, it's kind of two parts. First, you're going to look at a bunch of cartoons and hear me give my 2 cents on them. Then we're really going to get hands-on, explore the form, and you're going to be able to express your unique voices as you make your own cartoons. Just to give you a little bit more of a heads up, when we look at the cartoons, we're going to look at them in 3 ways. We're going to look backwards at the past, what they show us about history. We're going to look inwards and what they show us about ourselves, and we're going to look for what they misrepresent and get wrong along the way. When it comes to exploring the form, just going to go over quickly a little of the do's and don'ts of how you make a gag cartoon, and then again, you're going to do some exercises where you'll get to make your own. So before I get too into it, first I want to introduce myself a little bit. Who am I? I can't actually read these things from here. I am someone who has been waiting for a thing like graphic medicine for a long, long time. I just didn't know it. See, this is me when I was 10 years old, and this is what 10-year-old me said he wanted to be when he grew up. Be a comic book artist or a doctor. So as you can see at the time, I thought it was an either-or type of thing. I didn't know about graphic medicine. I didn't know you could do both. So I ultimately made the choice to go into medicine because I knew how you become a doctor. I knew about going to med school. I had no idea how the hell you become a cartoonist. It's still not entirely clear to me. So I went to medical school, and I learned a lot of things. I learned how to spell sphygmomanometer. I learned what, in fact, the knee bone is connected to. And most importantly of all, I learned that I wanted to be a cartoonist more than I wanted to be a doctor. So what I ended up doing is I dropped out of my internal medicine residency after finishing my internship to pursue cartooning full-time, which, as you can imagine, my parents were really happy about. But it all worked out, and somehow I managed to combine the 2 parts together, which is usually, something that people look at me oddly about, but I guess everyone here does something like that. So now I work with my alma mater, Columbia University, making a variety of visual, creative educational tools. This is taken from a panel from an interactive comic book textbook of the eye, meant for 3rd-year medical students in their ophthalmology rotation. This is from the social media feed of Columbia's Department of Surgery, where I make, just fun, light patient education and engagement resources. And this is a comic made by a medical student of mine in a course on narrative medicine that I teach. So narrative medicine is a program that's all about the intersection between science and the humanities, and in my class we use comics and cartoons to help students develop skills related to communication, to empathy, and to self-reflection. So a big part of what I do is this comic medicine mashup, but I also have a big part of my identity that's cartoon related that doesn't really have anything to do with medicine, and that's that I'm a staff cartoonist for the New Yorker. And for those of you unfamiliar with the New Yorker, it's one of the oldest, most prestigious magazines in America. It's been published continuously weekly for over 90 years now, and it's known for a few things. It's in-depth, rigorously fact-checked journalism. It's witty cultural criticism, and it's stupid, goofy gag cartoons like this one by the great Sam Gross. I got a job. So here's an example of one of mine, a stupid, goofy gag cartoon. Here's another medically related one. He's waking up places people. So these are called gag cartoons, not because they make you want to gag, although I'm sure you'll see ones that make you want to gag, but but because every element of the cartoon is in service of telling one specific joke or gag. And as you can see, there are very few elements to these cartoons. There's just a single image and usually a line or two of text at most. That's the caption. Sometimes not even that much, as in this classic cartoon by perhaps the most famous New Yorker cartoonist, Charles Addams. So, I'm biased, but I really love the gag cartooning form. I think it works like a quick hit of comedy. A lot of times it's just sort of a light diversion, something to make you smile as your eyes drift away from a more serious article as you're reading the magazine. But because these cartoons tell a story with so few elements, they also have this terrific knack for distilling complicated issues into just simple truths. They really help bring our feelings into focus. I'll show you some famous examples of that. In the early 90s, when people were starting to first get on the internet and everyone's coming up with their new screen name, we were having fun, but it was also a little uneasy, and I think this cartoon summarized our feelings. On the internet, nobody knows you're a dog. Here's an example of a cartoon that summarizes some of the frustrations we feel in the working world, but that we really can't say out loud. Thursday's How About Never is never good for you. Here's a cartoon that resonated so deeply the line became part of our vernacular. Well, back to the old drawing board. This is where that phrase comes from. This is from 1940. It's by Peter Arna. And circling back to something a little more medically related, this by the great Roz Chast. I think this single image summarizes our complex relationship with our own mortality, as well as any book, movie, play, or television show. So, again, because there's so few elements to a gag cartoon, so little to work with, over the years, cartoonists have started to develop their own vocabulary, and they go back to things that they know will work, tropes, scenarios, situations, and so you get a lot of recurring gag types. So this is a desert island gag. You see a lot of these. Here's a Grim Reaper gag, very popular. There's the Guru on the Mountain gag. I'm not a guru, I'm just hanging out here till my renovation's done. There's, of course, the business meeting gag. And the reason we're here is the medical gag. Have you popped all those pills I prescribed? So, how often do cartoonists come back to the medical gag? 2% of all New Yorker cartoons ever are medically related. So 2%, is that supposed to be a big number or a small number? It's actually, in this context, supposed to be a big number, because when you look at some of these other popular cliches, Desert Island gags are 0.4% of all cartoons. Grim Reaper gags, 0.13%. Let's compare doctors to another profession we love to make fun of. Compared to lawyers, lawyers are 1.5% of all New Yorker cartoons. So that 2% is actually pretty sizable. And again, when you think about this collection of 90 years worth of cartoons, there's over 80,000 cartoons total. That 2% adds up to a lot of doctor cartoons. It's a good collection, and it's a collection I think is worth looking at today because it lets us look at ourselves in the mirror. For those of us in the healthcare world or interested in healthcare, it gives us a little bit of reality testing, because even though the New Yorker cartoon is a very specific point of view, it tells us something about how people are viewing those of us in medicine. And because it's been reflecting for such a long time, it gives us a little bit about the historical background that informs some of those views. So let's start there with what they show us about our history. As we look at this as a historical perspective, let's take a moment just to think about who the messenger is. Cartoons are made by cartoonists, right? And no one would ever accuse a cartoonist of being a normal, average person. But in this context, I think we can agree that cartoonists experience the healthcare world the way most of us do. Most of us, maybe outside of this room, that aren't actively engaged. They experience it from the patient's point of view. And because all these cartoons that I'm going to show you are written in the time they happen, you know, these aren't looking back, we can think of this collection of cartoons as almost a people's history of medicine, something that's unfolding in real time. So we get a collection of cartoons commenting on all the times that medicine has been on our minds as a society. So going back to the 1940s and the World War II draft physicals, this is from Chilliers, It Just Me. The 1960s, the enactment of Medicare. You must stop addressing your Medicare patients as comrades. The 90s, the rise of HMOs and managed care. He's in an HMO, gets some of the king's horses and a few of the king's men. Remember the early 2000s when there was a mad cow scare? If one gets sick, we'll have to destroy the entire herd. And as we know these days, there's, for some reason, a controversy about vaccination. Connect the measles, it spells out my parents are idiots. So you get these great discrete snapshots of moments of time when we were thinking about medicine. And when you have enough snapshots on the same topic taken over a long enough span, you can trace an evolution. Now, we're talking about a visual medium, so let's start very superficially with just an evolution in style and in what a doctor looks like and how that's changed over time. When we think of a doctor now, we think of this long white lab coat. That's the visual icon of the doctor. So it's interesting to look back at cartoons from the 1920s and early and see how different the doctor looks back then. That's the doctor sitting down. You see the nice tails coming off of his coat. The doctor of the past, and this is from the 1940s, is a well-dressed man in a three-piece suit for the most part. He tends to look more like the Monopoly man than our mental image of a doctor. This cartoon is out of style for other reasons, too. When we do see the white coat, this is from the 1930s, it's kind of off-model. It doesn't look like the one we all know and have mixed feelings about. It can be high-collared, it can be double-breasted, it can be short-sleeved, it might actually be coming back in style. But it's really not until all the way until the late 70s that we really see the long white lab coat as solidified as the visual icon of the doctor. Before then, if there's anything that approaches a consistent visual calling card, it's not what the doctor's wearing, it's what the doctor is carrying. There's the doctor first in that line. He's carrying a medicine bag. And why is he carrying a medicine bag? Because he's going on house calls. Right? And that's another evolution we see in these cartoons. The rise and fall of the house call. So, I can't even read that from here. So when we look at these cartoons, we see a lot of house calls early on, but we don't see typically cartoons like this that actually make reference to the house call. For the most part, cartoons in the 20s, 30s, 40s, 50s, all the way to the 60s are like this. The house call is just the setting. It's a background element, but it doesn't need to be called out because why would it? This is just where we'd expect a medical encounter to take place. It's really not until the late 60s that we get a cartoon like this. No, I'm afraid the doctor doesn't make house calls, whatever they are. Where you see cartoons starting to react to what they're noticing, that doctors are making fewer and fewer of them. And from that point, now you start to see a lot of house call cartoons that are about house calls themselves and that are really outlining this grieving process. Well, wouldn't you make a house call if we brought the house over? And it is a grieving process because we really don't want to adapt to this change. Thank you, doctor. So few of you make house calls these days. But as this cartoon points out, it's a change we have to adapt to because we really don't have a lot of say in the matter. The doctor-patient relationship is a sacred thing. If I were to go to your house, it would somehow cheapen it. And because of that, we reluctantly start to accept things, and we shift our expectations. You mean you will make a house call? Wait a minute. How can we be sure you're not a quack? That's 1970. By the end of the 1970s, we've kind of accepted the loss. We realize this is gone, but we're not left without scars from the experience. It leaves us wondering, what's the next thing that we're not going to miss until it's gone? Is it this? Or is it this? It leaves us wondering. But again, we do make the adaptation. And let's look at another forced adaptation that we had to deal with, the case of smoking. And in particular, cigarette smoking. I know that that's a cigar. So, like the house call, in early cartoons like this one from the 1920s, the cigarette is just a background detail. It's just an expected part of the culture. Unlike the house call, though, it's so ubiquitous that it can't help but come to the forefront of cartoons from time to time. And, occasionally you see cartoons like this. Michelle, where's that air coming from? That sort of playfully point out that cigarettes do have their drawbacks, but no one's overly concerned. In a lot of ways, it reminds me of modern cartoons about cell phones and technology. They can be a nuisance, but we also love them. They're a part of our life. This is from a couple years ago. It's really not until 1950 that you start to see a cartoon like this, which is reacting to this new idea that maybe cigarettes aren't just an annoyance sometime, maybe that they're actually harmful to your health. 99% of all doctors have patients who smoke brigadiers. What's interesting is that the initial wave of cartoons in the 1950s all really focus on this from the tobacco industry's point of view and having fun with the problem they have to deal with. Please pardon the intrusion, Mr. Watson. We're from the R.J. Reynolds Tobacco Company. We understand you've been complaining of a case of throat irritation due to smoking Camels. And we can tell those are all doctors from their medical bag.
Both of those are parodies of actual advertising slogans. So the first one was 8 out of 10 doctors prefer Camels. The joke was at the time the other two preferred women. But and then this one is not one single case of throat irritation due to smoking Camels.
Yeah, that's exactly right. And those ad campaigns, and especially the way that the companies would use rather lamely doctors as their pitchmen, is a big part of what this first wave of reactions was all about. Here's one, I think that says it, and they're showing an ad with a doctor saying, do you want to live forever? And the cartoonists got a lot of mileage out of this at this time. But G-pop, they say the doctors all smoke them. We see it coming up over and over. I think this is a great image that just shows you at the time how close the association was between doctors and the tobacco company. But then it gets interesting in the late 50s and 1960. This is from 1961. You see the cartoonists shift their attention. So for a man who's going to quit smoking today, you aren't exactly starting off, what did I do, with a bang. Okay. So it's really, after years of making fun of the tobacco companies, it's only now that you start to see cartoonists shifting their attention to the general population. It's almost like, they were having so much fun thinking about what a big problem this is for big tobacco that it didn't hit them until a little later that this is actually a big problem for all of us because we're all smoking too. And once you get to that point, you get a lot of cartoons focused on that. And, you get cartoons like this looking backwards saying, maybe we should have seen this coming. If it turns out to be harmful, we can always quit. You get cartoons like this looking forward and wondering how far are things going to go. And when the day comes that cigarettes are completely outlawed. And really through the 60s and 70s, this is the primary focus of a lot of the cartoons. Yes, I'm restricting you to half a pack a day. This idea that we have this major struggle because we love cigarettes, but we know we shouldn't be smoking them. And that's why it's kind of dramatic once we get through to the 80s, and especially towards the end of the 80s. This is 1988. We've really, we haven't just accepted this, that we have to give this up reluctantly. We're not resigned to quit tobacco. We've actually dramatically shifted our values as a society so that, we're not really looking at tobacco as cigarettes as a situation where it's, I must but I can't. It's I won't and you shouldn't either. And that's fairly dramatic, and it gets to the point where you can have a cartoon like this from 2000. If you still want to belong to an organization dedicated to killing Americans, there's always the tobacco lobby. I mean, that's dramatic. You've gone from thinking about cigarettes as unhealthy to cigarettes as evil. And it gets to the point where you have cartoons nowadays by cartoonists who are born in the 80s and sort of after this shift has really started to take place, that can make a joke like this, which, the whole punchline here is really just pointing at a smoker and laughing, because the idea of smoking is so ridiculous. And no offense to any smokers in the room, by the way. So it's really a dramatic shift. It's not really a surprising story. This is the story we all have in our heads. Everyone used to smoke. Everyone quit smoking. We see it played out in other forms of entertainment. Mad Men sort of touched on this stuff. But looking at the cartoons, and because it's all being told in real time, we can get some more nuance to it. Let's turn our attention backwards for a second. Here's a cartoon from 1934. You men get this straight. We're not going to have any cigarette fiends on this squad. So this is one of several cartoons at the time that actually had a bit of a counterpoint that showed that not everyone was on board with smoking. But this cartoon caught my attention for another reason. It's this term, cigarette fiends. So this term wasn't just a generic insult that this cartoonist was using. This was actually a term used by a lot of the early 20th century critics of cigarette smoking. These were critics whose voices were eventually silenced and who faded away as cigarette popularity really boomed in the 1920s. And you think about these people, and they're calling for people to stop smoking years and years before everyone else was saying it. And you think these must have been smart, savvy people, right? It's a little more complicated than that, because these people, their arguments were not exactly what you would call evidence-based. And in fact, they were more based in emotion and morality. And their real argument, as this cartoon from 1925 is parodying, was that cigarettes made you lazy, cigarettes made you stupid, cigarettes turned you into a degenerative, and they made you a bad person. Again, it's not science-based at all. And I think this is part of why we look at history, because it helps inform how we see the present, and it lets us draw patterns. Because look back to this 1925 cartoon. What does this remind you of? If we look in panel 1, you take a puff of something funny. It leads you to harder drugs. It leads you to a life of crime. It ultimately leads to your death. To me, it reminds me of sort of the fear-based arguments against marijuana that they taught us in school. And what you realize is that the cigarette fiend didn't really fade away in the 1920s. The cigarette fiend just got rebranded, became the pothead or the burnout or whatever you want to use. Because we're always looking for a new boogeyman. We're always going to have that fear that drives us to find that. We're at a moment in time when marijuana is becoming more and more an accepted part of our society, and soon we'll have better evidence as to whether there is any legitimate reason to be concerned or not. But I can bet you for sure that as the pothead fades away, it's going to be replaced by a new boogeyman. Looking at history shows us we always want a boogeyman, we always want a villain. On a related note, it also shows us we also want a hero, a miracle cure-all. 1940, vitamin B, the pep vitamin. The 70s, vitamin C. Gee, Tyler, I thought everyone's doing vitamin E. The 80s gets a little more refined. Vitamin B6, vitamin B12, calcium, kelp, brewer's yeast. The 90s, I'll trade you my soy milk for your wheatgrass juice. The 2000s, sometimes I fear that wheat germ has been lost in the health food shuffle. And then you get to add, well, so much for antioxidants. We're always looking for the next big thing. How soon can you start on a fad diet? And like the boogeyman, a lot of these are more emotional based than science based, and as a result, both history and medicine show us that we're not always good at separating the bad guys from the good guys. I love this. They now think that kryptonite's actually good for you in small doses. To take sort of a dramatic modern example, these days we want everything to be gluten-free. I have no idea what gluten is either, but I'm avoiding it just to be safe. But there was a time we wanted things to be gluten-full. Do you think if we all got together we could persuade Mr. Kirby to carry gluten bread? This is 1937. You know, looking back at this inspired me to make a recent cartoon looking from the gluten's point of view. The gluten's back and it's pissed. But shameless self-promotion here.
It just
So-
appeared.
What's that?
That was very recent.
Yeah, that was like 2 weeks ago.
Yeah.
Yeah. So when we look back at history, when we take the longer view, when it comes to medical matters and health matters, as cliched as it sounds, the more things change, the more things seem to stay the same. Patterns repeat themselves, and it's really just the window dressing that changes. And the gag cartoon can really help highlight this because, again, since they're so sparse, they often have to dispel with the window dressing altogether. And what you're left with are cartoons like these that are meant to be completely topical and timely that actually end up being totally timeless. By the way, Euphoria Against Socialized Medicine. This could have ran in the run-up to the Affordable Care Act, when we're all talking about, you know, we want a single-payer system or not. This is from 1950 and is a response to Harry Truman's Fair Deal Act and his plan for universal health coverage. This too could have been about Obamacare. It's, you know, they're talking to Moses. When all these new rules impact adversely on the viability of small businesses with fewer than 50 employees. What do you think this is for? It's actually Hillary Clinton's plan for health care reform when she was First Lady in the 1990s. I think this is a great image that really captures some of the ongoing debate now about how patients can get better access to their own health information. It's from 1934.
Wow.
Here's a cartoon that I think comments on the most modern of problems. You've got data poisoning. It was the most modern of problems in 1965, too, when this was made. So the short, simple answer, what do they show us about our history? They show us that we can and we do adapt to change, but at our core, we remain remarkably consistent. And so what I want to talk about now is I want to look at that core a little more deeply. Look at our thoughts and feelings as they, in regards to what we think about doctors, what we think about ourselves in the role of patient. What do we think about illness? What do we think about the healthcare system? So what do we think about doctors? I want to run a few tests on you just to cover my ass. So here are a few of the more common traits of cartoon doctors. They're greedy, for hundreds of thousands of dollars. They're egotistical. Oh, he's reading his diplomas again. They're inconsiderate. It never ceases to amaze me what little brains people have. They can be downright hostile. You made that diagnosis just to be mean. And they can be stupid. Shows you how much I know. They can really be stupid. It's a good thing you're here. I just punctured your eardrum. Really, really stupid. Try jiggling the liver. I mean, seriously. 3 out of 4 doctors. And going back to this idea from history that we remain very consistent, these views of doctors are consistent too. So, you know, here's Greedy in 1940. He's not to be disturbed, and I took the liberty of taking $10 out of his pants pocket. Here's greedy now. You're Bill. I'd like to get these numbers up. Here's egotistical then. We're on closed-circuit television today, so you might gaze at me from time to time with a look of mute adoration. Egotistical now. Let the healing begin. I love that one. Inconsiderate then. Want to hear something funny? Inconsiderate now. Spoiler alert. Hostility then. The doctor has quit practicing. He's devoting all his time to suing people. Hostility now. Instead of an expensive, invasive procedure, we've decided to beat it out of you. And of course, classic stupid. By George, it is N. It always looked like an M to me. And I love this one, stupid modern style. I can catch, you can't throw.
Nice.
So, again, consistency. And I've just told you we should expect to see this kind of consistency. But when it comes to what we think about doctors and healthcare in particular, this consistency is actually a little different than the story we see when we look at other portrayals of doctors in entertainment. Particularly when we look at portrayals in TV and in the movies, we don't see these consistent reactions. We see a very clear story arc. We see, in earlier years, the doctor as this caring, selfless, noble intellectual, this knight in shining armor, guys like Dr. Kildare, Ben Casey. Sorry. Okay. Marcus Welby, MD. These guys are all heroes that we're supposed to admire and look up to. And it's only over time that the doctor transitions from being superhero to being a person, to being human, to being flawed, to being downright screwed up at times. You know, you get House, you get the soap opera of ER, you get the dreamy hunks of Grey's Anatomy. This is, you know, to the extent that we're thinking about this, this is sort of the story arc that we have in our mind, from superhero to mortal, from saint to sinner in a way. And certainly there is a lot of truth to it. I don't think anyone would deny that doctors used to hold a position of more respect and more authority than they do today. But what looking at the New Yorker cartoons helps us do is they help give us a bigger picture. They remind us that even during the days when the doctor was put up on a pedestal, we still like to talk smack about them. You know, we still like to make fun of them because, as we all know, there's a lot to make fun of when it comes to doctors. Let's look at how much mileage the cartoonists get just out of the cliches that doctors use. You're 57 years old. I'd like to get that down a bit. Yes, it's a routine procedure. If you routinely have someone slice open your body with sharp instruments and then fiddle with your inside, it was inspired by the cartoonist prostate surgery. We did everything we could. We're going to beat this thing apart. One word makes a difference. We'll have you out of here in no time. It's no wonder that as patients we need to respond to all these euphemisms by asking them to be more direct with us. Give it to me straight, doc, all systems go. Give it to me straight, doc, how long do I have to ignore your advice? Enough medical mumbo jumbo, just give it to me straight, doc. Will I ever be able to play the piano again? So what these cartoons capture is our consistent reactions, but what they also capture is this other running theme, which is when it comes to healthcare, when it comes to our relationship with doctors, we're very conflicted too. For example, you know, we clearly want them to be direct with us. We also worry about them being too direct. You're healthy enough for sexual activity, but not attractive enough. And, you know, when we look at it, what we really want is this. Give it to me nuanced, doc. What we find is that when it comes to a lot of aspects of our desires and expectations when it comes to physicians, that kind of conflict, self-conflict, really runs throughout all of it. You know, so we talked about how we think that the doctor can be stupid or selfish or greedy. If I knew where I'd lost the sponge, it wouldn't be lost now, would it? We still care so much about what they think about us. He says I'm a great patient. You know, not just as in their medical opinions, but we want them to like us as people. We want doctors to be like us. I want a doctor I can relate to, someone who's at least 15 pounds over his ideal weight. We don't want them to be too much like us. We worry that the doctor doesn't have enough control of the situation. Again, with the hip replacement, just sort of ripped off that. We also don't like when they have too much control of the situation. The amnio is fine, the sex is male, the name is Wade. We worry that they don't see us as people. Nice to put a face on a disease. But we also like to think that they really care about us. I've signed all the get well cards. I think it would be nice touch if you signed them too. Because we really do need them to care about us. Does the doctor hug? But still, we're worried about this fundamental misalignment in motivation. And again, that's consistent through time. In the old days, this is from 1929, when the doctor was a noble intellectual, we were still a little more worried that maybe they were motivated by intellectual curiosity than actual compassion. Oh, doctor, there must be something dreadful that's the matter with me. You look so pleased. These days, we just assume they're complete sellouts. This is a great image. Yet still, we want to believe that they don't just care about us, they put our interest above their own. I think the best thing you can possibly do is sue me. Litigation is often very therapeutic. And we see this similar theme of consistency and consistent self-conflict when the cartoons turn the focus from the doctors onto the patients themselves. As patients, we're capable of our own brand of stupidity. Are you sure you're not confusing manic depressive with awake asleep? We can be stubborn. I've told you thousands of times, there's nothing wrong with you. And our skepticism can often go over the line into paranoia. I won't read all this out. The joke is that the patient is making this doctor do this big, long oath. I won't harm you. I'll uphold this value. All to get to the punchline at the end. Now may I examine you? And when it comes to conflict, we're just as conflicted about our goals as we are about the people who help us achieve them. You can cure your back problem, but there's a risk you'll be left with nothing to talk about. And that's because illness becomes a big part of our identity. We want it, but we don't want it, but we don't want to give up on it. Nothing too aggressive, I'm kind of attached to my symptoms. Even when we know we don't want it, we also know we don't want to do anything about it. Will I still be able to not exercise? As a result, you know, as annoying as the doctor can be to us, we can be real pains in the ass for the doctor. I have to tell you, I got a totally different diagnosis from someone named Pookie Poo on MediAnswers.com. If there's any doctors in the room, this is probably a traumatic thing for you. Thank you for not mentioning Dr. Oz. How annoying is that? So why are we this way? Why are we so consistently skeptical about doctors, and why are we so conflicted about what we want out of them? I think the answer is actually pretty simple. I think it's because we're anxious. You know, I hope this guy knows what he's doing. When we go to the doctor, what are we doing? We're outsourcing our well-being to another person. And adding to that anxiety, we're not just going to the doctor to help us, we're going to that doctor to diagnose us. So they become just as associated with telling us about what's wrong with us as giving us any help fixing that. You know, I'm going to take your blood pressure, try to relax and not think about what a high reading might mean for your chances of living a long, healthy life. So this cartoon really summarizes how much it can feel we have at stake every time we visit the doctor. You got to ask this doctor everything you wanted to ask him. It really does sometimes feel like a matter of life or death, because ultimately we go to the doctor to help us stay alive. And when you think about it that way, as this cartoon demonstrates, I'm afraid it's your body, that's kind of a losing battle. We're asking the doctor to cure an incurable condition, being alive. So from that perspective, it's no wonder we're going to be worried and we're going to be anxious. Why not be happy about all the diseases you don't have? Because when it comes to medical matters, certainty is usually no more reassuring than uncertainty. If only it worked like this. Well, now that you know you have it, you can stop worrying about getting it. It leads to this bigger conflict within us of what our entire outlook should be. Should we be optimists? I'm sending you to someone who can afford your brand of optimism. Or should we be pessimists? You tested positive for being negative. It's very confusing, and we often shift back and forth. And what we see is often we're at our most optimistic when things are the bleakest. We're hoping for an uptick. And that seems kind of ironic, but it also makes sense, because when things are hopeless and there's no more medication left to help us, the only thing we can really control in that situation is our attitude. And I think that's why, for me personally, when I was going through these cartoons, some of the funniest cartoons were the absolute darkest. You're not so much crying on the inside as severely hemorrhaging. Because cartoons like this remind us of one of the most effective treatments of our attitude. It's humor. That's how we can improve it. Anywho, it's Malignant. I know why you could say that this is a tasteless cartoon, but I don't think cartoons like this, sometimes it helps to turn the question around. Why not you? I don't think they're actually unsympathetic. I think they're reminding us of what is one of the few effective treatments against pain that we can't otherwise deal with. What's the next best medicine? It's humor and it's laughter. It only hurts when I'm laughing on the inside and crying laughing on the outside and crying on the inside. Jokes don't cure our problems, but they release our tensions and they help deflect our anxieties. So this is kind of the moral of the story here. This is kind of the big picture, that jokes can help reconcile the conflict that defines a lot of our reactions to medicine and to doctors. And when you look at it through that perspective, we realize that these cartoons aren't just helping reflect what the problems are, they're helping us deal with the problems as well. That's sort of the big takeaway. Now, before I move on to the next section, though, I do want to point something important out, which is conflict does define a lot of how we feel about healthcare. There's one area of healthcare where we don't have mixed feelings. We're very decided. When it comes to the healthcare system itself, it kind of sucks. Good luck with the American healthcare system. There's no mixed feelings here. We don't like the long waits. Doctor isn't ready for you, but you've been bumped to the real waiting room. We don't like the gowns. Humiliation is a very important part of the process. We don't like the paperwork. The guy with the weird skin disease forgot to sign the privacy form. We don't like the insurance system. Your coverage doesn't seem to include illness. The over testing. Well, Bob, it looks like a paper cut. Just to be sure, let's do lots of tests. Over medication. These are for your tired feelings. These are for your sleeping. These are for your appetite. These are for your nerves. There's not even a punchline to this. This is what most medical encounters look like. The side effects that come with over-medication, that certainly is a nasty side effect. And this is really true, the poor follow-up that we're all dealing with because of what a complex system it's become. It's a simple stress test. You do your blood work, send it to the lab, and never get back to you with the results. It makes us wonder if this system is even really designed to help us at all. It's fine to discover cures, but remember, chronic conditions are our real bread and butter. I find that it's cartoons like this, whether you smile or you laugh out loud, these are the ones that elicit the most knowing nods, because we can all relate to this stuff, and again, we don't really feel that conflicted about it. A cartoon like this, ask your doctor if taking a pill to solve all your problems is right for you. That's clearly hyperbolic and exaggerated, and yet it also feels completely authentic to our experiences. And that's sort of the power of these cartoons, is that they use exaggeration, they use all these comic tricks to ultimately show you the world as it is, in a way that sometimes it can't simply be stated. They show us core truths, in other words. And that's why what I want to turn to now, though, is what happens when they show us something that feels like the truth, but they're actually spreading some myths along the way. As I said, because of the format, cartoonists have to rely on shorthand, they have to rely on stereotype, and as a result of that, whenever you play with stereotypes, you run the risk of inaccuracies and you run the risks of insensitivities. And here, I'm not even going to cover the insensitivities of the past. We've seen some sexist cartoons. We're talking about a 90-year span, so there are unfortunately many culturally insensitive cartoons. You know, you saw these witch doctor gags all from the 20s all the way up to the 60s, misrepresenting other cultures and outside views of medicine. But, you know, not to gloss over these because these are complicated things, but for right now we're going to just consider those mistakes of the past, and let's look at things that are ongoing. Some of which, unlike things like this, are quite benign and harmless, like this. What am I even talking about here? Not the puffer fish, but the thing on the doctor's head, the reflecting mirror. Totally a superficial detail, but also pretty inaccurate. Unless every cartoon doctor is an ENT or something, I don't know why they all wear a reflecting head mirror. If I sold medical supplies in the cartoon world, I would definitely want to stock up on head mirrors, though, because cartoon doctors seem to love them. It's a misrepresentation. Ultimately, I think it's rather meaningless, because what does it matter? It doesn't change our perceptions one way or the other. Similarly, I've been in a lot of ORs in my time. I've never been in one with a live studio audience. I understand that things like that, operating theaters, did used to exist, but if you went by the cartoons, you would think that they're the rule, not the exception. Again, misrepresentation, ultimately, I don't think it affects much, just interesting to note. But it shifts into something else, because let's look at another iconic misrepresentation, the psychiatrist couch, right? We see this all the time. Probably every issue of The New Yorker has a psychiatry gag with some sort of setup like this. And I think anyone who's had any experience with the mental health field knows that the psychiatrist couch was phased out a long, long time ago. And even amongst psychoanalysts, it's the exception, not the rule. And it's very easy to file this one with the head mirror and the operating theater as just a harmless misrepresentation. I know that it's easy as from the cartoonist perspective to go to, because it's so quickly understood, and it also makes a good visual prop. That's why I've used it in my own cartoons. But I've spoken to some psychiatrists, actually many psychiatrists firsthand, who think that it's not just a harmless misrepresentation. It actually is a little problematic, because, you know, you're going to go to the doctor anyway, and, you know, you're going to see whether they have a head mirror or not. It's not going to change anything. If you need surgery, you're going to get surgery. People don't go to the psychiatrist unless they really choose to go to the psychiatrist, for the most part. And because of that, they don't really see psychiatry much outside of popular representations of them. So to a lot of people, this really is sort of what their view of psychiatry is. And it's a weird view. It's something, you know, why am I sitting on this long couch? Why is the doctor not really looking at me? Is this what I'm in for? I've spoken to a lot of psychiatrists that think that it puts people off from actually seeking help. I think furthermore, by always showing psychiatry and psychology in this environment, it segregates it from other forms of healthcare, and it just further spreads this myth that mental health is something distinct from physical health, as this cartoon talks about. The old body checks out, now let's see what Doc Atkins here it makes of the old mind. It's a problem, and certainly the New Yorker itself isn't helping that. This is the cover to a collection of cartoons from just 2 years ago. The Book of Doctor Cartoons, Asterix, and Psychiatrist. You know, it's spreading this distinction when really there isn't one. But let's move on to the last misrepresentation I want to talk about, and it's a doozy. It relates to the cartoon doctor himself, and I very distinctly mean the doctor himself, because when we look at these cartoons, this is always the doctor. It's this guy. It's a man. When we see a female doctor, it's such an odd occurrence that most of the time it needs to be commented upon. And if you read the caption, many women are more at ease with a female doctor. That's why I'm wearing a wig. It's not even actually a female doctor. What we rarely see is something like this, where the doctor's gender is just a background detail. It's probably not shocking that there's a similar problem when it comes to racial diversity. Again, a cartoon like this is the exception, not the rule. I don't know if this came up on any of your guys' radar. This was I meant to say this is the rule, but this was all the rage amongst the gag cartooning community. So there's this group, the Proceedings of the Natural Institute of Science, aka PNIS, and yes, they are in on the joke. They're an interesting group. I have no affiliation with them. They try to popularize science by taking a methodical approach to subjects that we don't really think of as being scientific. So a few months ago, they turned their attention to doing a statistical analysis of New Yorker cartoons. And what they found confirmed what we can see just, by a quick glance through the history, that there's underrepresentation, that there's underrepresentation of women in New Yorker cartoons, not just as doctors, but in every walk of life, and of minorities. Particularly troubling, that's underrepresentation compared to the actual population, and also compared to other forms of entertainment. And that's not just concerning, that's bad. That's not how it should be. And my colleagues and I have to do a better job. And I can speak for myself and say that I will do a better job. But that's really my thoughts and opinions on all of this stuff. It's my first pass after reading way, way too many cartoons and trying to make sense of them. For me personally, I'm working on my next step, which is doing a little bit more rigorous research on all of this, testing things out like, first of all, do people agree that the darker cartoons tend to be funnier? Or looking at how people within the healthcare field measure the humor of these cartoons versus people outside the healthcare field. Is there a difference? But that research hasn't been done yet. For now, you're left with my opinions. Anytime you're talking about a medical subject, I think it's always good to get a second opinion. So for a second opinion, I turn to my fellow cartoonists, the people that make these cartoons, some of my favorites. Michael Maslin, does he usually ooze this much sincerity? Paul Noth, do you find it painful when I get hungry? P.C. Bay, you have a non-lethal form of anthrax. Chris Wayne, try to focus less on a cure and more on treatment you can afford. And of course, the great Roz Chast, the MRI of life. So, how are we doing on time? I asked them a few questions, and I'll just sort of summarize the answers. I asked them what's so funny about doctors. I wrote down their answers. So basically, to answer this, Chris Wayant and Paul Noth both sort of focused in on the power that they hold over us, and also the seriousness that's expected from them. Basically, the more powerful and the more serious someone is, the easier it is to take them down a little bit. And a lot of humor comes from punching up, right, not punching down. So that makes them ripe for comedy. Roz Chast found comedy from the way that doctors make her feel so anxious. Anxiety was also a big part of Roz's answer to what's funny about us as patients. If you're not familiar with Roz Chast, anxiety is a big part of what she does. Other answers to this question were, Paul Noth thought that nudity was a big part of what makes us funny as patients, the fact that we strip down. Michael Maslin, sort of related to anxiety, also added in helplessness and fear. And I like P.C. Bay's optimistic answer. What's funny about us as patients is that we subject ourselves to a healthcare system designed to slowly kill us. And the last thing I asked them was, what's the function of medical cartoons? Do they help us avoid difficult topics, or do they help us confront them? Paul Noth was decided. He thought that, for him personally at least, medical cartoons help him avoid thinking about difficult subjects. For Michael Maslin, they were pretty functional. For him, it helped him work out anger he felt towards the system. P.C. Bay gave sort of a philosophical answer. He thought that medical cartoons help you whistle in the dark. And I really like Roz Chast's answer. She said that when it comes to making jokes about death and illness, making jokes is one atom better than not making jokes. and I sought out one more opinion, the opinion of the person who matters most to us New Yorker cartoonists, because he's our editor, Bob Mankoff. This is the guy who decides whether our cartoons get in the magazine or not. He's a cartoonist himself. We've seen several of his cartoons. And he's also something of an expert on the psychology of humor. So Bob said that humor often comes from high ideals being undermined by low motives. And since a doctor professes to have the highest ideals, what with the Hippocratic Oath, they're most undermined by hypocritical practice. What makes us funny as patients, he feels, is our self-deception. We know that all our ills can't be cured with a single pill, but we're still always looking for that single pill. He feels that jokes can open up a discussion and relieve tension. They give us control when we really have none, and that's why he thinks we see so many Grim Reaper cartoons in the magazine. We know he's going to have the last laugh. We might as well have all the laughs up till then. He also, I thought this was interesting, he feels that medical jokes have, over time, eroded the authority of the doctor, but that, in his view, that's a good thing, because that increases the empowerment on the patient's part, and that leads to patients feeling more comfortable asking questions, being a little more skeptical, and that leads to better treatment and better outcomes. I asked him if he'd seen any changes in medical cartoons over the years he's been editor. He said that, he's seen both the public and the cartoonists themselves become more knowledgeable about medical matters, being more aware about things like experimental and control groups, placebo, and things like that. And that's led to more sophisticated cartoons. So that's an example of one of Bob's sophisticated medical cartoons. I also decided to settle the question while I had all these cartoonists' attention of what the funniest organ is. 1 vote for the gallbladder, 1 vote for the appendix, 1 vote for the uvula, 1 vote for the penis, and 2 votes for the butt. So there you have it. It's the butt. The butt is the funniest organ. All right, so you've heard from me, you've heard from some other cartoonists, but now let's really get into it and let's start making our own cartoons. First, just a note of why I think it's worth actually not just listening about this, but practicing it. If you're interested in healthcare or if you're a healthcare practitioner, again, because of this idea that gag cartoons require you to say a lot with so little, they really focus on direct, clear, concise communication. And to do that effectively, they also make you focus on putting yourself in the head of the reader, the person you're dealing with. You need to be able to know at all times what they know and what they don't know, and where your common ground is. And these are skills that are important for any healthcare practitioner, and these are skills that you go through medical school, they talk about how important they are, but they're rarely taught directly, and you're mostly expected to just sort of pick them up as you go along for some reason. So practicing these cartoons in a playful way actually lets us practice these skills. They also let us process our emotions, because we'll make cartoons relating to healthcare matters, and that lets us work out frustrations, work out anxieties, without getting too angry or too depressed, because we're still in a playful frame of mind. So, when we make cartoons, where do they start? They start with an idea. Where do ideas come from? I have no idea. I wish I knew. But when you're trying to search for one, you can fall back on certain patterns that have been helpful. These are some sort of broad approaches you can take to come up with an idea. Observational cartoons look at behaviors, look at expressions, phrases people are using, like people talking about their design sensibilities. What can you do with that? A ton of cartoons can come from just simple exaggeration. Take an element and push it all the way up to 11. This is a teaching hospital. Similarly, you can get a lot of mileage out of just literalization. You aren't getting enough clothing. We see a lot of cartoons that are rooted in opposites. You flip the context to something, so say that bad news becomes good news, or good news becomes bad news. And then, I don't even know what the official name for this is. I'm calling it connect the dots, but a lot of cartoons are made from taking these loose associations and tying them together. So, we look at sonograms on the screen, we look at social media on the screen. They're not connected, but that makes a connection. Put them together, you can get a laugh out of it. these aren't formulas you can use to come up with ideas, but they're starting points and they lead you on, your own personal brainstorm. You'll get to a good idea eventually. Once you have something you want to work with, just a few more tips and pointers of how to really bring that to the next level. First of all, this sounds really basic and straightforward, but sometimes we lose sight of this. You're making these cartoons, you can play to your strengths. You can stack the deck in your favor. If you're a stronger writer than you are an artist, make the caption do the heavy lifting. Put the joke in there. If you're a fine artist but you can't draw horses, you're not obliged to draw a cartoon about horses. Even if you came up with a great horse idea, you'll think of another idea, I promise. I know that sounds basic, but sometimes in the moment we lose focus of things like that. The moment itself is very important when it comes to New Yorker cartoons because you're capturing one very specific snapshot in time. You need to choose where you're going to take the click of that metaphorical camera. If you choose the wrong moment, you may be capturing something that's too broad or too subtle. A good rule of thumb that I've found helpful is try to get that moment right after whatever bit of silliness or weirdness has occurred, but right before the other people in the cartoon have reacted to it. When it comes to the caption, don't get too precious with it, but certain phrasing elements matter. Generally speaking, again, none of these are rules, but generally speaking, it's good to put the punchline as close to the end of the sentence as you can. You only have this one sentence to work with. You want to end on a high note. So it's a subtle thing, but that means saying, on the internet, nobody knows you're a dog, as opposed to nobody knows you're a dog on the internet. Also, when it comes to your caption, keep it brief as possible. There's this tendency to overwrite, to put in superfluous information because maybe you don't trust your drawing to set up where you are, or sometimes people have a habit of they try to throw in silly names, well, Mrs. Lipschitz, it's about this. Resist those urges, trust that your idea will be clear, that you can make it clear. Resist the funny names. You're telling one joke. You don't need to try to add another joke in it. You're just not helping your cause. And while you don't want to underwrite, at the same time you don't want to underdraw. You can look through the magazine and you can see cartoonists that have these very sparse styles that are, sans background, that are with characters that are not much more than stick figures. If any of you read the webcomic XKCD, you can do a hell of a lot with stick figures. You can definitely make gags with them, but you just have to keep in mind that even if you're going simple, you need to have every element in there that will let people know where this cartoon is taking place, who these characters are, what their relationship is to each other. Related to that, and again, this is going to sound like simple stuff, but I've seen so many submissions where people lose sight of this. I've lost sight of this itself. You want to keep those relationships as crystal clear as you can, which means if this character is talking, you want their face to the reader. Don't put their back to the reader. You need to be able to see their mouth. Their mouth needs to be open. If they're talking to this character over here, they should be looking in that direction unless there's a reason for them not to. This character here is not talking, then don't draw his or her mouth open. Straightforward, we forget about it. Just keep it in mind. All right, so that's basically all I know about cartooning. It's really not that much to know. You guys can do this. We're going to start with exercises now. First one, we're going to do a caption contest. If you read the magazine, they take a cartoon, they remove the caption from it, and then they have readers come up with their own caption. It's not about solving the problem of figuring out what the caption was. It's about coming up with your own idea that makes this funny. So there's no right or wrong answer to this, of course, but this is the right answer. Well, so we're coming to the end of our time. So I hope that maybe you've learned a little bit something about medical cartoons in the New Yorker, what they show us about the past and what they show us about ourselves, and hope you've learned a little bit about the gag format itself and how it can be used to practice skills that are actually relevant to clinical practice, and how it can be used as a processing tool for your own emotions. And if you haven't learned anything about any of that, I hope you've had fun looking at cartoons for an hour and change.
Yeah.
Thank you.
Thanks for listening to the Graphic Medicine Podcast. I'm MK Serwick, co-curator of the website graphicmedicine.org. New episodes of the Graphic Medicine Podcast will be posted weekly. Don't forget to subscribe in iTunes, and while you're there, it would be great if you could leave us a review. On our next episode, another stellar presentation from the 2015 Graphic Medicine Conference in Riverside, California. And it's my pleasure to remind you that support for this podcast comes from Penn State College of Medicine, Department of Humanities, the nation's oldest humanities department within a medical school, pioneers of innovation in medical education since 1967. Thanks for listening.